of your expertise, insights, and perspectives. So, and speaking on that, could you explain what occupational therapy is and what occupational therapist or occupational therapist actually does?
So, thank you for the awesome introduction on occupational therapy. Yeah, so occupational therapy, as you were saying, is often misunderstood because people hear occupation and therapy and then they think that it's mainly focused on jobs. You know, that we are a healthcare profession, we focus on jobs.
Yes.
However, I'll start with just a general understanding of it, or definition of occupational therapy, just in general.
Yes,
and then I'll go and explain it more in depth in a way that people understand better.
Oh, yes,
So in general, what occupational therapy is, it's a healthcare profession and it's focused on providing a more holistic treatment for patients, especially those who have had injuries and have maybe faced any disability, so that we can help them to be able to re-engage in life and engage in meaningful activities, like activities that they find meaningful, whether it may be in work or at school or anywhere. So that's the general definition of occupational therapy. However, a nice way for people to actually understand it is just to break down the two terms of occupation and therapy. So occupation, as we're saying, it sounds like jobs, but it's not jobs.
I also thought of that as
yeah.
well.
Yes. So it's not just jobs. So it does cover some parts of of jobs, but there's the main aspects I'd want to focus on is that occupations are broader than jobs. So you know that with a child, they actually have an occupation. So a child's occupation is play. And then you go with a teenager, as they get older, their occupation is more education or focused on education and going to school. And then you go to an adult, then they may be going to work. But even if they're not going to work, there are smaller things that we're doing every day. Getting ready in the morning. Getting ready, you have to brush your teeth, make your bed, bath, eat, and everything, take medication, whatever it may be. Those things are occupations. They're small, but they are occupations. And we sometimes only see how meaningful those small occupations are when we get injured or maybe get into any disability or whatever it may be.
So just to better understand, you'd say even someone who's at home, like they have that occupation to be like a homemaker. So even then, if they were to get injured, you just help them or treat them on a holistic point of view, if I'm not mistaken.
Yes, you're correct. You're absolutely correct. So even when someone's just at home, even the activities they engage in are occupations. And it's important for them to be able to be independent in those occupations so that they can also live a meaningful life. So then the therapy part, I forgot to explain that part. The therapy part is more improvement. So now providing improvement or providing treatment. So now we're focusing on providing improvement or treatment for those occupations.